Hello everyone, welcome back to Your Thoughts Are Valid, and I hope you all are doing great. So in today's video, we are going to learn about Apgar scale, what it is and what is its clinical significance, and then what are its limitations. So let's start with the video. In 1952, Dr. Virginia Apgar, an anesthesiologist at Columbia University, developed this scale. Okay, so basically, she named this scale on her surname. That's why we call it as Apgar scale. So this score is a rapid method for assessing a neonate immediately after birth. Just remember that this is used after a child is born, immediately after that, and in response to resuscitation. What does this term mean? Resuscitation, it is basically it means like the action or process of reviving someone from unconsciousness. Okay, so it's basically like when child comes out of the mother, uh, like the child starts crying. So it is basically like the child was in unconscious state, and basically the whole process of resuscitation, basically making the child come to consciousness. So it is this score is basically used to assess that whole process. Okay, it is used immediately after birth and in the whole process of making the baby come back to consciousness from unconsciousness. And what are the elements of Apgar score? There are five elements, or we can say five dimensions, which include color, heart rate, reflexes, muscle tone, and respiration. Okay, color, heart rate, reflexes, muscle tone, and respiration. CAR scoring is designed to assess for signs of hemodynamic compromise, such as cyanosis, hypoperfusion, bradycardia, hypotonia, respiratory depression, or apnea. Okay, so what does this mean? All of these terms. So we will start with hemodynamic. So hemodynamic basically means dynamic of blood flow. Okay, hemo, we all know that it is hemo. Whenever we use the term hemo, it means we are talking about blood. So hemodynamics is basically basically based on the blood flow. Okay, so we use Apgar scale to assess signs for hemodynamic compromise, which can include cyanosis. What is the meaning of cyanosis? Cyanosis is basically means blue skin, okay, bluish or grayish color of the skin, nails, lips, or around the eyes. Okay, blue skin can have causes that aren't due to underlying diseases, which can be, just due to because of the if the environment is too cold, or mm, like the person is wearing tight clothes or jewelry. But these are like just some examples, not like in neonates it is possible. Okay, so in neonates, if there is like a color differentiation, or if there is cyanosis like blue skin, then we need to find out what is the reason behind it. Okay, then what is there? Hypoperfusion. So what does that mean? Hypoperfusion is a term that describes a reduced amount of blood flow. Okay, it basically means reduced amount of blood flow. Then what is bradycardia? Bradycardia is basically slow heart rate. Okay. Then there is hypotonia. What does that mean? It is basically about weak muscle tone. Okay. What is it? Weak muscle tone. It can be used to understand respiratory depression, like to identify if there is any respiratory depression, like any problem in breathing or any type of apnea. Okay, then each element is scored 0, 1, or 2. Okay, each element, each of the dimensions is scored 0, 1, or 2. Also, what does apnea mean? like just the term apnea. Apnea is like when you stop breathing while asleep or have almost no airflow. Okay. Usually, like, you must have heard the term sleep apnea. Okay. So, like that only. It is related to that only, but not just about, it is not just related to sleep. It can be just apnea. Then each element is scored 0, 1, or 2. The score is recorded at 1 minute and 5 minutes in all infants, with expanded recording at 5-minute intervals for infants who score 7 or less at 5 minutes, and in those requiring resuscitation as a method for monitoring response. Scores of 7 to 10 are considered reassuring. Okay, so it is recorded between 1 minute to 5 minute in all infants just after they are born. And like if the score is 7 or less than that, then you have to again take this scoring after gap of 5 minutes. Okay. Or maybe we use this technique of taking 5-minute intervals and doing the scoring again, in which we use the technique of resuscitation. Okay, then scores of 7 to 10 are considered reassuring. Then Apgar scores may vary with gestational age, birth weight, maternal medications, drug use or anesthesia, and congenital anomalies. Okay, so it is basically about when the child is born and what is the weight of the child, or we can just say neonate, or if mother was taking any medications that can have an impact on that, or if there was any drug use or anesthesia or any congenital anomalies. Moving on, technique or treatment. So basically, there are 5 parts of an Apgar score. Each category is weighed evenly and assigned a value of 0, 1, or 2. The components are then added together to give a total score that is recorded at 1 and 5 minutes after birth. A score of 7 to 10 is considered reassuring. A score of 4 to 6 is moderately abnormal. And a score of 0 to 3 is deemed to be low in full term and late preterm infants. Okay. Then, how do we calculate the score? So if we talk about the breathing effort dimension, so if the infant is not breathing, respiratory score is 0. If respirations are slow and irregular or weak or gasping, then respiratory score is 1. And if infant is crying vigorously, then it means the respiratory score is 2. Then heart rate. Note, heart rate is evaluated with a stethoscope, and it is the most critical part of the score in determining the need for resuscitation. If there is no heartbeat, then heart rate score is 0. If the heart rate is less than 100 beats per minute, the heart rate score is 1. If the heart rate is more than 100 beats per minute, the heart rate score is 2. Then muscle tone. If the muscle tone is loose and floppy without activity, score will be 0. If it demonstrates some tone and flexion, then score is 1. If the infant is in active motion with a flexed muscle tone that resists extension, the score for muscle tone is 2. Then grimace response or reflex irritability in response to stimulation. If there is no response to stimulation, reflex irritability response score is 0. If there is grimacing in response to stimulation, reflex irritability response is 1 score. If the infant cries, coughs, or sneezes on stimulation, reflex irritability response is 2. And the last dimension is color. Note, most infants will score 1 for color, as peripheral cyanosis is common among normal infants. Color can also be misleading in non-white infants. If the infant is pale or blue, score for color is 0. If the infant is pink but the extremities are blue, the score for color is 1. If the infant is entirely pink, the score for color is 2. Okay, so that is how we score. Here is the scoring chart. Okay, what are the dimensions? Appearance, pulse, grimace, activity, respiration. So we also called it Apgar based on these 5 dimensions. Okay, it is also the surname of the uh, founder, or basically whoever the person who made this scale. and also the five dimensions it has: appearance, pulse, grimace, activity, and respirations. Okay, so we have already discussed when we will give 0 point, when we will give 1 point, and when we will give 2 points. So this is just for the reference. Sorry for the background noise. Moving on, what are the limitations of Apgar score? Apgar score has perceived serious criticism in recent years for characterizing healthy skin as pink, which does not adequately address the health of newborns with darker skin. Okay, like basically people who are dark, or neonates who are dark in color, they won't, the pink color won't be visible. So that is like one of the major criticism or limitation. And a 2023 report found that using skin color to detect cyanosis, jaundice, or any other disorder in newborn led to false positive and false negative results. The report stated that more accurate ways to assess an infant's health by appearance included color of lips, color of tongue, or pulse oximetry. Other considerations that can affect an Apgar score include sedation or anesthesia of the birthing parent, congenital malformations, gestational age, or trauma. A healthy preterm infant may also score low without actually having oxygen problems. And many doctors don't consider the Apgar scoring system to be perfect. So that is it. That is all about Apgar scoring, Apgar scale. So if you have any doubt, please do ask in the comment section. And I hope Apgar scale is clear to you all. And thank you so much for watching the video.